Conventional medicine has emerged as the leading cause of death and injury in the United States. Instead of lifting up people's well-being, the American medical system is now doing more harm than good. Hospitals, which are supposed to be a safe haven for the ill, are plagued with medical malpractice and errors. In 1999, up to 100,000 people every year were at risk of dying from mistakes made in the hospital. 10 years later, that number rose to 180,000. Today, that number could be as high as 440,000 casualties of medical mistakes. Hospitals are also notorious breeding grounds for infections. Every day, 1 in 25 patients in the U.S. gets at least one infection associated with their hospital stay. Nearly 2 million people acquire a hospital infection every year, resulting in 90,000 deaths. The most common infections acquired in hospitals are pneumonia, surgical site infections, gastrointestinal infections, urinary tract infections, and bloodstream infections. But the most alarming are infections brought on by antibiotic-resistant bacteria. Antibiotic-resistant infections affect more than 2 million Americans every year, killing about 23,000 and accounting for a staggering $20 billion in annual direct healthcare costs. The conventional medical system has also transformed the U.S. into a drug-dependent nation. Nearly 70% of all Americans are taking at least one prescription drug for a chronic or medical condition. Antibiotics, antidepressants, and opiates top the list. 1 in 5 Americans takes at least one psychiatric drug. 1 in 4 senior citizens takes 10 to 19 pills a day and fills over 30 different prescriptions a year. If you add in drugs prescribed for other chronic senior conditions such as GERD, angina, depression, rheumatoid arthritis, and congestive heart failure, that could easily add up to 24 or more drugs a day. Children are being overtreated with medications and vaccines. In fact, they are the leading growth demographic for the drug industry. This growing dependency on drugs is not only putting our health on the line, but it is also placing a huge financial burden on our shoulders. But is this excessive reliance on medications improving our quality of health? Not at all. Americans actually spend more on healthcare than any other industrialized nation, yet it is not notably superior to any of the other 12 comparable nations. 15,000 people die every year in the U.S. from overdoses of opiate and narcotic pain pills. Between 1999 and 2010, the number of women who died due to pain pill overdoses increased by a staggering 400%. Even the younger generation is now falling victim to the perils of this system. In a recent study of 29 economically advanced countries, the U.S. ranked 26th in child well-being. Out of the 29 developed countries, the U.S. is 26th in infant mortality, just ahead of Slovakia, Latvia, and Romania. The only countries with infant mortality rates higher than 6 per 1,000 births are the U.S., Latvia, Romania, and Slovakia. Among 29 developed countries, the U.S. surpasses all in having the largest percentage of children aged 11, 13, and 15 who are overweight, a trend that predisposes them to chronic diseases as they grow up. These numbers reflect a health emergency in America. It's time to take control of your health. Instead, reward yourself with the fit, lean body that comes from clean and healthy lifestyle habits.